This is Dr. James, and we're going to talk about a term that most of you probably haven't ever heard, and hopefully you don't hear. It's called laryngomalacia. It's actually something that happens that you see fairly quickly after a baby's born. See, in our trachea, our big airway that goes down our neck into our lungs, around them, about 3/4 of the way around, is cartilage rings. If you've ever seen anatomy pictures, you probably have seen these drawn as white rings with little muscles in between. And in laryngomalacia, this cartilage ring is not as thick or as stiff as it should be. And then what this leads to is a baby that when they cry or take a deep breath in, the airway collapses and it will cause noisy breathing. And a lot of times stridor sounds like this. It's terrifying. Now, in a normal baby that's healthy, they're making this noise, especially when they're crying, and babies cry a lot, or when they get excited and they take a deep breath. And it's not anything to worry about, even though it sounds scary. Except if they have something like croup, which is a middle airway infection where it causes swelling of the airway. Now the airway is smaller than it should be. Now when it collapses, it's even smaller. So now when we have normal babies who are having problems with croup and having stridor, now you can imagine the kid who has stridor just because they take a deep breath, now is going to have even worse stridor. So their croup is going to be much more severe and much scarier. Now, the nice thing about laryngomalacia, if there is a nice thing, is that usually they're going to outgrow it by the time they're a year old. And it's not just like it's a light switch and at a year old it's better. It's as they go along, that cartilage is going to get stiffer and thicker, and it's become less and less of a problem as we go along. So most of the time, they're going to, by the time they're a year old, be completely fine with no remnants of laryngomalacia. But during that process of that first year while you're scared, or when the babies get sick, you may have problems. A lot of times, your doctor will send you to either an ear, nose, and throat doctor or a pulmonologist to confirm the diagnosis. Now, why would they do this? To make sure that there's not any sort of obstruction there that might make that sound too, like a problem with vocal cords or some just airway obstruction where we might have a narrowing that's there all the time. The laryngomalacia is usually going to go away on its own, but something wrong like a paralysis of a vocal cord or a foreign body on the vocal cord or a growth on the vocal cord or some sort of vascular blood vessel that goes across the airway and makes us have a hard time breathing. Things like that won't go away and sometimes have to be surgically corrected. So it's important to know, yes, this is definitely what we have, and when we get in trouble, what we need to look for and where we need to go for help.